with most of these people's stuff. All right, so perform hand hygiene. Okay, knock. Hi, my name is Nisha. I'm your student nurse today. Would it be okay if my instructor watches? Yes, perfect. Okay, so today we're gonna perform a head-to-toe assessment on you, basically checking you from your head to your feet. Are you okay with that? Yes, perfect. All right, can we start by you tell me what your name and date of birth is? Jane Smith. All right, perfect. Yep, that matches. Okay, also, can you tell me where you are? At Gurnick. Awesome. Do you know why you're here? For a head-to-toe assessment. Perfect. So my patient is alert-oriented times 4. Okay. All right. So Mrs. Jane, I'm just going to check with my pen light. Okay. I'm going to check your hair, and then I'm going to look in your eyes, nose, and so on. Okay. So I'm going to start with looking at your hair. So my patient's hair appears healthy and well kept. Okay. Scalp has no signs of abrasions, no wounds, no lice infestations. Right. Next, can I look at your eyes? So I'm going to shine my light in your eyes really quick. Okay, perfect. All right, and then with just your eyes, can you follow the tip of my pin? Awesome. Perfect. One more. Perfect. Okay, so my patient's pupils are equal, round, reactive to light and accommodation. And then I'm just going to pull down your lower lids. Perfect. My patient's conjunctiva sacs are pink and moist. Their sclera is white and their cornea is clear. Okay. All right, Mrs. Smith, next I'm going to look in your ears, shine my light in your ears and behind your ears, if you could look the other way. Perfect. No skin breakdown behind the ears and no excess cerumen in the ears. Okay. I'm not going to because there's so many of you, but you would walk around. Okay. So don't reach over. But for me, we're gonna do this. All right, looking in behind the ears. So again, no excess cerumen, no skin breakdown behind the ears. All right, next I'm going to look in your nose, okay, and just shine my light. So there's no sign of deviated septums and my patient has no nasal cannulas or NG tubes. All right, can you say aw for me really big, Mrs. Smith? Perfect. Okay, so my patient has all of her natural teeth. They all look in good condition. Gums are pink and healthy. Okay, there's no signs of slough on her tongue. Perfect, Mrs. Smith, thank you for that. And then can I just have you look this way? Can you turn the other way as well? Perfect. Look up and down. Awesome. So my patient has range of motion of her head and neck. Okay, next I'm going to come down here, Mrs. Smith, and I'm just going to feel both of your arms. So my patient's arms feel warm to the touch. There's no signs of rashes, lesions, scarring. She has no IVs, no abrasions. Okay. Next, I'm going to just come down here and look at your nails. All right. So nails look healthy. They are clean. They're not broken or brittle. All right. And her capillary refills are all less than 3 seconds. Next, I'm just going to hold on to your wrist for just a second. Okay. So my patient's radial pulse is +3 bilaterally. All right, Mrs. Smith, can you just push against my hands for me? So push, perfect. And then I'm gonna have you pull, awesome. And then can you squeeze my fingers? Great. So my patient's upper extremity strength is strong bilateral, okay? All right, Mrs. Smith, next I'm going to come right here and look at your chest. So just looking at your chest, it does look symmetrical, right? And then looking at your abdomen, the abdomen also looks symmetrical. There's an even rise and fall of her chest, okay? I'm gonna use my stethoscope and just listen to your lung sound. So when I do so, if you could just take a deep breath for me, okay? So I'm gonna listen to 8 in the front and then 10 in the back. So breathe, perfect. 2, 3, 4, awesome. All right, and we're gonna go 5, 6, okay? And then 7, 8, perfect. All right, and then can I have you turn to your side and we'll just listen to your back. Yes, awesome. Turn. Okay. And then I'm gonna listen to the 10 on the back. So there's 1, 2, deep breath, 3, 4, deep breath, 5, 6, deep breath, 7, 8, deep breath, okay, and then 9, and one more here, 10. Perfect. All right. So my patient's lungs sound clear. No adventitious lung sounds were heard. Okay. Next, while I'm here, I'm also going to listen for your heart valves. Okay, so I'm going to turn it over. Okay, so I'm gonna listen on the bell side of my stethoscope, and I'm going to start on your right side here. Okay, so I'm gonna start with your aortic. which is at the second intercostal space, right sternal border. Then I'm gonna move over to your pulmonic, which is at the second intercostal space, left sternal border. All right, then I'm gonna come down to your tricuspid, which is at the, if I can get it over there, fourth intercostal space, left sternal border. And then I'm going to come over here to your mitral, which is at the fifth intercostal space, mid-clavicular line. Okay, all right, valves sound good. So I'm gonna turn it over to the diaphragm, and now I'm going to assess for 1 full minute. Okay, my patient's apical pulse was 70, right? Perfect, Mrs. Smith. Next, I'm going to come down here, and I'm going to look at your abdomen. So again, it is symmetrical. There's no signs of an ostomy, okay, or G-tubes or any other feeding tubes, all right? It looks flat, non-distended, okay? So next I'm going to actually listen. I almost fell. I'm gonna listen to it now, and I'm gonna start here at the lower right quadrant, and then I'm gonna listen to the right upper quadrant, left upper quadrant, left lower quadrant, okay? My patient's bowel sounds are present in all 4 quadrants. All right, Mrs. Smith, next I'm just going to press on your abdomen, okay? Let me know if you have any discomfort when I do so. Okay, perfect. So my patient had no pain or discomfort. Abdomen is soft to touch. It's non-distended. There was no presence of masses, or masses, okay? So now, Mrs. Smith, I'm just gonna come down here and assess your peri area. Is that okay? No? Okay. So if I were to assess your peri area, I would be looking for any discharge, any foul odor, any skin breakdown or sores, okay? Mrs. Smith, would it be okay if I assess your bottom? No? Okay. If I were to assess her bottom, I would be looking for any rashes, skin breakdown, the presence of hemorrhoids or any other sores, okay? While I'm in this area as well, Mrs. Smith, when was the last time you had a bowel movement? This morning, okay. Do you remember the color? Brown, perfect. And then do you remember if it was hard or soft? Soft? Awesome. And what about the last time you voided? 30 minutes ago. Do you remember the color of that? Light yellow. Awesome. Okay, did you have any foul odor, any burning? No? Perfect. Okay. All right, so next I'm going to come down, Mrs. Smith, and I'm just going to feel your legs, your lower extremities. All right, so lower extremities are warm to the touch. Again, there's no signs of skin breakdown, no rashes, no lesions. Okay, also when I was assessing peri area, there was no signs of a catheter. All right, and then feeling on the patient's legs, there is no signs of edema here at all. Okay, so Mrs. Smith, next I'm going to come down to your feet, and I'm going to just check your capillary refills on each toe. Capillary refills are all less than 3 seconds. All right, and then I'm going to feel your pedal pulses. All right, pedal pulses are +3 bilaterally as well. The next thing I'm going to do is have you push against my hand, okay? And then can you pull your toes to your head? Perfect. Can you squeeze outwards against my hands? And then can you squeeze inwards? Perfect. So my patient's strength is strong and equal bilaterally. All right, Mrs. Smith, the next thing I need to do here is I'm going to just lift your leg here. Can you flex your toes for me one more time? Perfect. And how about down? Awesome. Okay, and then we're gonna do the next one and down again. Did you have any pain when doing that? No. Okay, so then my patient is negative for a DVT. Okay. All right, Mrs. Smith, the next thing we need to do is vitals. Okay, so blood pressure, cuff is going on. Before I do the blood pressure, I am also going to take temp, so we can use our temp gun. What else? Drill blank right there.
Oxygen.
Yes, okay, I'm gonna throw my pulse ox on, which I thought I brought, oh, I did. Right, I'm gonna throw the pulse ox on, and while we wait for that to read, Mrs. Smith, there you go. Okay, so temp was 97.7 degrees Fahrenheit. Pulse ox is 99% on room air. Okay, now we're going to do your blood pressure, right? So I'm gonna get this ready. While I'm getting everything ready, do you, on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, what was your pain like today? 0? Okay, so my patient reports no pain. Okay, so then we're gonna pump up. All right, perfect. Blood pressure was 120/80. All right, so thank you, Mrs. Smith. All right, and then the next thing I'm going to do is assess your wrist one more time, okay? All right, so my patient's respirations were 16, okay? Okay, go. All right, then the last thing, Mrs. Smith, is I'm just going to recap that there were no signs of IVs, no feeding tubes, Okay. Overall, my patient appears happy and healthy. She was alert and oriented. She tolerated the assessment well with no complaints of pain. Okay. Mrs. Smith, if you have no questions for me, that concludes my head to toe. Okay. So I'm going to lower the bed back down to the lowest height, give you your call light, put your side rail back up, and that's it. That's my head to toe.
All right.
That's it.